I'm back.
Hello everyone and welcome to SoftFil Academy's webinar. We are very happy to welcome all of you. Of course, a very warm welcome to Dr. Riekie Smit. Thank you for being with us.
Thank you very much. It's really an honor to be again part of the Academy and to share some knowledge, and I'm looking forward to the interaction also.
Yes, definitely. I will just start a little bit slowly this webinar to give time to everyone to start connecting. So I will explain first of all how this webinar will be divided. So Dr. Smit will start her presentation, and please wait until the end of her presentation to get the answer to all of your questions. Don't hesitate to ask your questions in the chat or in the Q&A section. And also please note that this webinar is being recorded and it will be available from tomorrow on SoftFil Academy's website and on our YouTube platform. So if we can please go to the next slides. I will start by introducing our speaker tonight, Dr. Riekie Smit, who is an aesthetic physician from South Africa. She has a private practice in Pretoria, focusing on aesthetic treatments and aesthetic and skin treatments. Beside her practice, Dr. Smit also holds the positions of senior faculty member of the American Academy of Aesthetic Medicine, training doctors in various continents. She is the founder of the Aesthetic and Anti-Aging Medicine Society in South Africa, the scientific chairperson of the Aesthetic Medicine Congress in South Africa. She also is the course developer for the officially recognized Advanced Diploma in Aesthetic Medicine in South Africa. Dr. Smit is a global KOL for various aesthetic medical and pharmaceutical companies in the industry. She is an international trainer on aesthetic medical subjects and author of medical articles, journals, and scientific publications. Of course, Dr. Smit is also an expert of our SoftFil Academy, who has a great knowledge of all of our products. So we are very excited to hear everything she has to teach us tonight. So
thank you. Yes, thank you so much for the wonderful introduction. And yes, I'm very happy to be part of the SoftFil Academy and a KOL. I really love the products and the new innovations, and always there's something new and interesting. It's always a very interesting company to work with.
Thank you so much. So the theme tonight, the title of this webinar is Full Face Treatment for Skin Biostimulation. So I will leave you now, Dr. Smit, to start your presentation.
Thank you very much, and for the wonderful introduction. And yes, I decided to talk about quite a very trendy topic at this stage, which is skin biostimulation and skin biorestructuring. And I think we're seeing a lot of new products on the market, and some of them are not necessarily new, but re-entering the market specifically for skin restructuring. So we know there is definitely a very big aesthetic demand, but we also have some barriers as to how to actually improve the skin quality. So knowing how to improve the skin quality is a really vital, important part to start treating. Obviously, we have our peelings that work specifically on the top layers, the epidermis. So talking about our superficial peelings that will improve the skin quality, the color of the skin, some photo damage. We've got stronger peels that will also help a lot for photo aging, such as your TCA peels. Then we have lasers that can treat also photo aging and also give collagen stimulation. But often what we sit with is these patients that we do peelings, we do lasers, we do toxin, we do fillers, but their skin remained wrinkled. It's really thin skin, wrinkled skin. And it's really almost like you want to restructure the skin and build up. And this is where biorestructuring fillers have really come into the market and now suddenly again making a big boom in the market. Now, what we also see from the public is there's a lot of focus of skin quality. If we just look at social media and apps that especially women work with, the first thing that they do on the app is to give a very good filter or maybe make the skin look better. So skin quality is really important, and it's almost like a status symbol, a health symbol, sexiness symbol. So skin quality is one of the most important aspects for people to look good and to look healthy and to look successful. So there's increased awareness of it, and there's definitely an increased aesthetic demand. Whereas many years ago, I can remember a lot of patients came to me and said, I want to maybe have my frown treated, or I want my lips treated. Now, the biggest thing that they come and they say, I don't like the wrinkles on my skin. I don't like the quality of my skin. So quite a lot of focus, a lot of articles. This is just a reference of one of the articles looking at exactly what happens with the skin aging. And I think as doctors, it's important for us to understand what happens and how we can address it. So this whole term of skin biostimulation, skin boosting, skin restructuring, and skin remodeling or biorevitalization has been published, it's been spoken about. There's a lot of evidence also on what we have to do these treatments. So this evening, I will focus specifically on how we can utilize cannulas to help us to obtain this in a safe way, because one of the biggest barriers I find with these skin quality treatments or injectables is the side effects of it. So we can really overcome these side effects by using good techniques, and this is what I will discuss. Because the aim of this treatment is really to stimulate collagen and also specifically to stimulate the dermal fibroblast so that we can get replication, new protein synthesis, and collagen boosting. Now, the side effects of these type of skin fillers, if we can call it that, because we've been talking about dermal fillers for many years, but most of the time we're not treating the dermis. So we're treating most of the fillers deep on the periosteum or on the fat pads, but these specific products are really aimed to treat in the dermis. But if we do place it inside the dermis directly with a needle, we tend to get these papular nodule formations, and this has really been a barrier. So initially, when the skin boosters came onto the market, doctors were very excited of this wonderful treatment. It showed collagen stimulation, but they left a lot of the patients with months, 6 months to 12 months of nodule formation, especially in the neck area, around the eye area. Then eventually some of the companies came up with special injectors that really minimizes the amount of product that we place. But still, there also remains some nodule formation. So this is especially where I think cannulas can really help us a lot to get better placement of the product in just the subdermal, like the hypodermal level, where it still reaches the dermis. And this has been shown with studies. And that was actually the previous slide that showed the collagen stimulation for 12 months and even up to 18 months. This is a study from Filmed on art filler, which I will be showing the demonstrations. And this is not placed inside the dermis, but actually in the hypodermis. So showing that we don't need to put that really intradermal, like these little papules, to get this collagen boosting effect. So the other problems also with these skin fillers and skin boosting type of procedures is that we still have a risk of intravascular injections, as we can see from this in a published article. We get hematomas. A lot of patients complained, I want to have this treatment, but I don't want downtime. And we could never before, with a needle technique, even if you use a 30 gauge, 32 gauge needle, we cannot promise that there will not be bruising, that there will not be hematomas. So we had to really time it for the patient and in your clinic, maybe for like a Friday afternoon, so they can recover over the weekend. We also saw, especially in the neck area, that's very popular for treatment, also these hematomas or nodule formations. So that is exactly why I started using the SoftFil, and obviously loving the EasyGuide. It makes it so much easier for these type of treatments, but it's not the same as using it for fillers that we place in the deeper levels in the fat pads or on the bone. It's a much more superficial level. And what I find with the EasyGuide is, first of all, it's easy because you don't have to look for the hole. It's less painful for the patient, but it really helps you to not go too deep with the cannula. Because usually when we insert the needle and then we put the cannula in, we kind of dive in perpendicularly. So we tend to go too deep. And with this specific procedure, the EasyGuide really forces you to go into a more superficial plane, because we don't want to put those wonderful soft filler products in too deep a plane and not have that dermal stimulation. So this is the one place where I still also like the Precision SoftFil where you use the needle, but especially for these procedures, I would really recommend you to use the EasyGuide. So for those that do not know the EasyGuide, it's this really beautiful little butterfly or an eagle. I never know what it looks like, but it's very typical to the butterflies that we use in the hospital. But it's got this half needle that's hollow that guides you, and I'll show you in my practical videos. And it gives you really firmness and stability to place the cannula then in the right place. And especially if your eyes are not good anymore, it's really perfect. And for workshops where you can never find the hole, the EasyGuide is perfect. So let's start first of all with the forehead. Now the forehead is the only place where we do not place it in the subcutaneous layer. So most of our soft hyaluronic acid fillers, or even the new skin boosting type of other non-hyaluronic acid fillers, are placed in this most superficial subcutaneous layer to be as close as possible to the dermis. And the reason for that is because we want that collagen boosting on the dermis. The forehead is the only exclusion. So the forehead, the fillers placed in the supraperiosteal plane. And that's due to safety, first of all, and also because these pictures of these two articles of Professor Kim are really beautiful, but it looks almost like we've got a lot of tissue on the forehead. And actually, in fact, we don't have. It's so thin. The skin is paper thin. The fat pads are paper thin. The muscles are paper thin. So if you had to place your filler in this really subcutaneous layer, you often see the outline of the filler. So this is the only exclusion to the whole face, is that on the forehead, we actually place it on the bone. And this has also been shown with studies to still give you the collagen boosting effect. The other reason why we place it on the bone is because it's a safer plane to avoid intravascular injection. Now we're going to work with a cannula. It's not always so easy on the forehead because there's a lot of adhesions, and there's a lot of our supratracheal and supraorbital nerves that you pass that can be quite tender, but a really beautiful and wonderful procedure that patients love. So the first video that I'm going to share with you, you can see inserting the EasyGuide. I'm working with a 25 gauge and a 50 millimeter. You could also go with a 70 millimeter, especially in male foreheads, a large forehead. I would suggest, if you're not used to cannulas, to maybe start with a 50 millimeter. Because the 70 millimeter requires a little bit more being used to a cannula. So 50 millimeter gives you a little bit more precision. So you usually start on the temporal crest. Now you can see this patient has got very, very thin skin. We can see all the blood vessels. You can even see bruising, although I went in between the blood vessels. So this really helps a lot by using a cannula of this size to avoid damaging these vascular structures. And also, I really want to be supraperiosteal because otherwise you see the filler. And now we are fanning the filler. So the filler that I'm using is a very low viscosity hyaluronic acid filler, very low cross-link, and it's also got added hyaluronic acid, free hyaluronic acid. It is from the company Filmed. It's called the Fine Line product because they have some really interesting studies on the forehead. But any of your biostimulation type of fillers that you're placing in the forehead, place it on the supraperiosteal level. Make sure that you really focus a lot on the area underneath the frontal bossing, so in the midline. It's not always easy to reach the midline without pain for the patient, so then I often choose a second entry point right in the midline. Just be careful for the central vein that we often can puncture there, so just look clear nicely with a good light. And now I'm using the 30 millimeter, the 25 gauge 30 millimeter. It's a cannula that I've come to love. It's very nice if you want to be very precise and you don't want your cannula to go into areas where you don't want it to go. It's wonderful for nose, for eye area, for earlobes. I made a very special new video today on the earlobes.